The next fascinating set of muscles are in the Thenar eminence, which is the set of small muscles that give us the unique movements in our thumb, which allow grasping and apposition of the thumb. So in other words, where the tip of the thumb comes into contact with the tip of the fingers. And the only way you can do that is by rotating the base of the thumb, and then you have this pincer grip, which makes the hand an incredibly useful structure for vital things like texting. So, we're going to look at two of the muscles that sit in this Thenar eminence. And the one muscle is the adductor pollicis, and the other is the opponens pollicis. The adductor pollicis, and it is this muscle arises from the third metatarsal. It's got a broad area of attachment, and then it narrows down like a triangle, joining into the base of the actual phalanx of the thumb. So it pulls over and slightly flexes the thumb like that, and it pulls it inwards. So if I draw that, the metacarpals run here. This is the second metacarpal. So the adductor has this broad base like that, and then it runs across like this, joining in here. And as I say, you can see if it contracts, it'll pull the thumb, adduct the thumb in that direction. The trigger point is just here, and the pain is referred to here, to this area of the thumb. So middle of the thumb, what turns it on is if you adduct, if you pull your thumb in, and just the whole thumb actually, that's it. Pull the whole thumb in towards, and that, if that movement is if you do that movement recurrently, or if that's a restricted movement, that will turn this trigger on, and you feel the pain in this phalanx, the proximal phalanx of the thumb. The way to treat the trigger is, because the long axis is in this direction, you seek for it, running across, feeling for a tight band. Once you've found the actual trigger, you press down. Now, the choice is that you can press down onto the first metacarpal, but I find that it works better to put your thumb underneath the second metacarpal here, so you can push down into the palm, but I find it works better if I push down onto the first metacarpal and compress it like that. So I'm going down and this way. And use ischemic principles, press just to the point of pain, reduce the pressure, slowly increase until the trigger turns off. You use cold, starting on the origin, running it over and running it into the pain zone, 2 or 3 like that, and then the stretch is just straight out. And again, 2 or 3 passes, then relax, then heat, and then stretch again. The next muscle is probably the most important muscle in the thumb, because it is the one that rotates the base. Now that arises from the retinaculum that runs across the top of the carpal tunnel. So it arises from here, and it runs along like this, and it wraps around the first metacarpal. So it comes like this and wraps around like that. Origin is here, and the muscle is like that. The trigger point occurs here. And in fact, I know Travell and Simon speak of one trigger point. I often find 2 or even 3 trigger points in this muscle. And it's a very, I found a common trigger point, or these are common trigger points to find. And it originally was called Weeder's thumb. So in people who are manual, who spend a lot of time doing stuff and pulling and pulling and pulling, or doing recurrent work, this is a common trigger to get. The place you feel your pain is down here. So in other words, you feel it over the joint, or you feel it going into the thumb. You don't feel it often where the muscle is. And that's again the catch, because to get osteoarthritis in this joint, which is the most important, the carpo-metacarpal joint, the first carpo-metacarpal joint, this is the important joint of the thumb where the rotation and opposition, the opponens, the apposition of thumb to fingers for the pincer grip, this is where a lot of people get osteoarthritis. So they will come in, they're manual, or they do lots of stuff with their hands. Knitters also get this. And then you do an x-ray, and they're not actually terribly tender over the joint, but that's where the pain is. And what's missed is this trigger, or these little triggers in there. And the way that you treat it, again, searching for it. And what I tend to find is that the long fibers are this way, so I'm searching across like this. I feel a tight band, I search and I find the trigger, and the trigger is, I come in and I push against the metacarpal. So I come in, push against the metacarpal using my thumb behind. These are often exquisitely tender. So immediately back off and just breathe, relax, increase the pressure slowly until it melts away. Now, to stretch this muscle, what you need to do is not only go that way, but you need to pull it back. So you can see that I'm taking, I put my hand around the thumb and I'm rotating it, because it rotates this way. I'm rotating the thumb back, and I'm pulling it in a plantar flexed way. Sorry, in a dorsiflexing it. So I'm dorsiflexing, rotating, and pulling back like that. Cold tends to be really effective for this, starting here, running across into the pain zone. 2 or 3 runs, stretch, in the stretch position, 2 or 3 runs again. Then heat, and then repeat the stretch. And there you have it.